Right to our top story now. Across the nation, there's been an increase in reported cases of COVID-19 and increased levels of the virus in wastewater. Data from the CDC actually shows numbers higher in Texas. 6 News reporter Sydney Deshawn spoke with Baylor Scott and White, who helps explain ways to protect yourself against the infection. She's here to explain. Sydney?
Chris, CDC data shows virus activity in wastewater has more than quadrupled in America since June 1st. And some people are wondering why this may be and how to stay safe.
We call it the summer wave.
Across the nation and even here in Central Texas.
Especially over the last 2 weeks, we've seen an uptake in COVID cases.
That's because more people are traveling.
And kind of going into more closed group celebrations, and it's a little bit more hot outside, so people are tending to stay more indoors.
Dr. Weymeyer is a family medicine medical director with Baylor Scott and White. He says the current variant, KP3, is what they're seeing.
It's a variant of the Omicron.
Medical professionals monitor it all through wastewater.
We're not testing at sites. We're not testing in the clinics as much unless people are symptomatic. We're not testing at home. When certain levels get higher, then of course the virus is replicating and being shedded in those ways that show up in our wastewater. And right now we're on kind of a peak, compared to the last 6 months.
Most people are just having some congestion.
Some people are having fever, and some people are having some respiratory symptoms like a prolonged cold, and some people are having a real high fever.
To stay safe, Dr. Weymeyer says a new vaccine targeting this variant is coming out this fall.
What we've been telling people in the medical community is don't go out and get vaccinated right now. If it's been 6 months, been 12 months since your last vaccine or more, wait till this new vaccine is out.
And Dr. Weymeyer says there's no need to panic.
If you're a little worried about the impact of this, get vaccinated. Otherwise, it's nothing like what we've seen in the past.
And right now in Central Texas, Dr. Weymeyer says we have Saharan dust and allergens are high if you have allergies, but it's more intense. He recommends keeping a swab on hand. And for the kids going back to school, if they have runny noses or a fever, he says parents should test them. Chris?
Yep. Good advice. Okay, well, guess we're not done with it yet. It's back again. Thanks, Sydney.